people with real jobs.
Hello?
Self-employed people. Which do you want to be? This is Certifiably Unemployable. It's time to fire the boss and become self-employed. Maybe you need a push to get that business or side gig going that you've been dreaming about for years. And if you're an entrepreneur, you can listen to stories and get experience from people who've done it. Get ready to change your life. Broadcasting from the compound, this is Certifiably Unemployable, and this is Sean Dean.
Welcome to Certifiably Unemployable. I am your host, Sean Dean, and thank you for making us a part of your week as we are moving forward and making you certifiably unemployable. Looking to start your own business. Maybe you're a business owner and you've got a lot of questions about this particular topic because we're going to be talking about insurance today. And we have a special guest. Her name is Dr. Noor Ali. And she's actually a Bangladesh American medical doctor and surgeon on a mission to help the middleman when it comes to health insurance. Dr. Noor speaks for the self-employed individuals and families who need affordable yet quality health care, yet fall into the abyss of overpriced, underwhelming coverage options. Oftentimes, they just end up saying, forget about it altogether when it comes to this benefit. She currently lives in Tampa, Florida with her husband and her son. And as a first-time mom with a baby born into this Corona era, she's learned a lot, master mommying and being a high-performing worker at all her professional roles. So you can find her on Instagram at Dr.Noor_health. Welcome to Certifiably Unemployable. Thank you so much for joining us.
Thank you so much, Sean Dean. I really appreciate your time and allowing me this platform to speak to your listeners on Certifiably Unemployable. Thank you so much.
My pleasure. And when I saw your interest in our podcast, number one, I really appreciate that because that says a lot about the message we're trying to spread out and everything else. And being an entrepreneur, we are 100% a very unique individual, very unique group of individuals, I should say. And there's a lot of knowledge. I know I've been self-employed since I was 18 years old. Full-time self-employed since 2001. I've owned traditional businesses and different types of businesses, but there's always been a certain lack of knowledge when it comes to the industry of insurance. You know, when I have never been a corporate America person. I mean, I've worked for large companies and I've had benefits and things of that nature. But when you take the plunge from moving from corporate or from working for someone else that gives you the benefits, the 401ks, the insurance and everything else, nobody ever knows where to turn, especially with insurance. So I am very excited about today's topic, and having someone who is an expert on the field and can help the middleman like us self-employed people is very appreciative. So tell us a little bit about yourself, what your background is. I know that you're a doctor, so tell us about that and what exactly do you do?
Yeah, thank you so much. Yeah, you said so many great things. I just want to address, to all the listeners, as well as all the episodes I've heard on your show, what really attracted me to this show was because once you know that you are certifiably unemployable, you're different. You can't have a boss, you can't do this W-2 thing anymore. And so it's a very unique audience that you have, as well as a very unique, base. So I really appreciate that. So thank you again for having me. A little bit about myself. I am from Bangladesh. That's my native country. I went to medical school there. I did my training there. My business practice in the United States, and I'm self-employed as well, so I totally get it, also serves the small business community, the 1099 community, those who know that you're different, you're special, you can't work for anyone else but yourself. And my role is really to help them understand and find the best fit health insurance options. I am licensed as a 215 professional, so I've taken all the tests required to become a health insurance professional. And my goal is really just to educate and inform. Once you start this journey, there's a big range. You've done it your whole life. You're different when you start out, and you're different mid-career, and you're different when you're hands off and you let other people do your work. And you have different needs at every stage of your business. So my role is really just to evaluate where you are in your business and advise the best fit health insurance options for yourself or for your employees.
Perfect. So you're So you're almost like the liaison between us and the insurance company, right?
That's right. That's
Okay.
right. I just really help you understand what the options are and then find and pick the best fit options. I don't charge anything for my services. My role is really just to connect you to the right plan. Once I do that role, all you do is you pay for your benefits. So I think that's really cool because a lot of people are a little apprehensive, like, oh, I hardly understand or care about this. I don't want to bring on someone who's an expert in this field and do this work for me. But really, my job is just to help connect you to the appropriate plan.
Okay. And you had touched on it a little bit. I want to make sure that I understand something that you had stated, because right now, if you're starting a business, somebody's starting a business, naturally what their business looks like today is going to be different tomorrow and 5 years and 10 years from now. So are you able to help them through that process? So, because obviously what their plan is today and they add employees and their company grows, it's going to look different down the road, correct?
Yes, absolutely. Not only that, there's so many other variables that go into making health insurance so daunting and so difficult. Not only is it your individual perspective at the stage of your business, insurance is actually governed by state laws, not by federal law. So each state has their own set of laws for offering different insurance plan. They have different factors that go into what private companies are going to offer their insurance options to those living in the state. And of course, elections and laws and they're governing, different things are changing all the time. So those external factors of the state governed plans, as well as the internal factors of what stage in your business is what makes this so complicated and convoluted. And absolutely, I do help with at any stage of the business.
All right, perfect. So why is health insurance so difficult? Why is it such a daunting topic?
Yeah, great question. And I think it's because I want to use the word fear here. We fear things that we don't understand. Insurance is, and I'm here to like break that concept. Insurance is equated to the word scam. Everyone's just like, oh, I don't want insurance. It's all a scam. All of it is a scam. And that's really because you just don't understand it, I want to say. I think any industry that requires you to take some tests, become a licensed professional, become certified, right? It's worth working with or speaking to a professional in that industry to help you connect to those services. So insurance is one of those. One of the reasons it's so daunting is people just don't understand it,
Right.
So they're just like, it's just a scam. But really, if you understand what your policy is, and it's a whole different world, you've got terms like premiums, deductibles, copays, it's worth just sitting down and trying to understand it. And that's something I force it on all my clients. Like, oh, no, you're going to sit down and you're going to understand it. So down the road, when you have to make a decision again, you're going to make a more informed decision.
Okay. All right. So what is the most common thing that an entrepreneur, if they're gaining the regular W-2s, they get the weekly paycheck and everything else, what would you say is the most common denominator between entrepreneurs that you come in contact with first time with them?
Yeah, I would say that it's so much, when you decide to make the leap from your W-2 work to become, self-employed, there's so many things you have to take care of. And there's a list and there's a priority. Health insurance is at the bottom of that list of priorities. And often I find that it's just an afterthought for a lot of small business owners. And after they go through all the things they have to go through, sometimes they just end up forget about it. I just can't even deal with it. I don't get it. I don't want it. And I just can't even deal with it. So I find that the reason health insurance benefits just become an afterthought for a lot of people is because it's deprioritized and they don't understand it. And they just don't even know the first place to look. Like, what do I even Google to start here?
Right. Well, you brought up a good point, because when you go on Google and you type in something, you don't know what rat hole you're going down. You have no idea where you end up, and you're like, how did I get here? And then you don't know if it's legit. I mean, right away you start thinking all these things because you don't know who you're dealing with. Again, you don't know what is something you can really depend on. And that's why I can go back to what you said earlier, whether it's insurance or even if you're buying or selling a house, things like that. There are certain things in our lives where we have to be willing to spend a couple of dollars or at least tap into the professional, because That's why they're there. That's why they're licensed. That's why they are who they are. Right.
Yeah. And I think to just paint a picture. You mentioned Google, and that's like when we don't know what to do, I think Google is the first place we run to it. We don't know where to start and then where to end up. I'd like to kind of paint a picture of options for your listeners and for self-employed professionals. When you start out, and you know you need health insurance, you don't know where to start, I'd like to tell you the options in America and where it stands and what I recommend. And to make it really clear, there's two branches. You've got private and you've got public. So your government marketplace, that's healthcare.gov, politically known as Obamacare, whatever you want to call it,
Right.
healthsherpa.com is another one. That's your state marketplace where anyone and everyone can just log on, put in some details, and get a list of plans to shop from, right? Now, a few key notes about those two. There's a stage in your business where that's appropriate, but then there's also some cons as well. If you're just starting out in your business and your income hasn't started rolling yet, your revenue stream hasn't started rolling yet, that may be a good place to start because you can get subsidized plans from the government marketplace there, okay? So that's tied to your income, not tied to your health. So it doesn't matter if you're chronically ill, if you've had cancer in your history, if you can show a lower income, depending on where you are in the federal poverty level, you can get pretty good plans. But those plans come with a cost, and that is a high deductible, an HMO network, smaller network,
Right.
which may not be as desirable. But when you're just starting out in your business, you don't have that option to choose. So I would say consider that when you're just starting out. However, if you start doing well in your business in the first year and the second year, and you've exceeded, let's say 300 to 400% of the federal poverty level defined by your state that year, you will no longer qualify for that government subsidy. All of a sudden, your premium on that marketplace on the same plan is going to skyrocket 100 to 500% more. And all of a sudden, you're just like, oh my God, what is this? Forget this. I can't even deal with insurance anymore. So that's when the private market comes into play. And that's when it's a better option for small business owners and self-employed people. The private market plans, and this is where I really specialize in, you can do something like a medically underwritten policy. And these are plans that are tied to your health, not on your income. So no matter how much money you make, we want you to be successful. We don't want you to get punished with health insurance for making more money. We're going to give you a plan that's going to lock in a price regardless of how much money you make, as long as you're generally healthy. Now, some people may get offended by this, like, oh, why, you can't ask me about my health or what status. But if you're a successful entrepreneur and you're generally healthy, you can do much, much better with a private plan that's tied to your health, not to your income.
Yeah, I've heard many people, talking about the Affordable Care Act, the Obamacare, that if they were over a threshold of like 30,000 a year or something like that, that it was a real challenge for them.
That's exactly right. That's exactly right. But again, there's pros and cons. There's always going to be a population that's unhappy. I always try to say, leverage your position. No matter where you are in your business, adjust your health insurance benefits to work for you. Insurance is not a scam if you understand it, right? So why don't we utilize our position or where we are in our business stage to make our health insurance plan work for us? So the consumer can win, right? Not the insurance company.
I've heard many times, I don't know if it's true or not, but I've heard many times that insurance companies, they look at it as the average customer of theirs carries a policy for about 18 months, right? They're used to switching it up because you either change jobs or your company goes into a different provider, whatever the case may be. So they understand that it has to adapt with us. So I'm sure it's not anything new for them, right?
No, not at all. Absolutely. Exactly. And there's a very high turnover in this industry as well, especially because of the laws are changing all the time, and as a consumer, you really have to be smart to, keep up with it and adapt as the system adapts. And it's a lot to ask for. You started your new business. You have so many things to work about. Do you really want to keep up with insurance news and laws? No, let a professional do it. So that's what I really try to help all my clients with.
Okay. Well, I know you're not a CPA, but I do have a question I want to ask that might have a CPA spin on it. Sure. When it comes to insurance, let's say I'm full-time self-employed. I have the opportunity to speak with you and you can put me in contact with some insurance providers. However, my wife has a full-time job that has benefits and I can get the insurance benefit from her. Is there a benefit for a self-employed person to take advantage of the insurance through their company, through their portal, or would it be a better idea for them to go through their spouse's provider?
That's a fantastic question. And the answer is it truly depends on a few things. What is the benefit that your wife's employer is giving you? Smaller companies give amazing benefits for their employees, but once you start adding husbands and kids, spouses and dependents, the prices skyrocket.
Right.
In that situation, I would say sometimes it makes more sense for the self-employed spouse to get their own plan. And that's called a split family plan. And I recommend it really depending on what your spouse's employer benefits are. However, if we find that, hey, it's costing you less to go on your spouse's employer plan than to get your own, definitely do that as well. So the answer is it depends. I'm going to ask you, what's your situation, your health status? How often do you really use insurance? How much is it costing you? Let's do a cost benefit analysis and find out.
Okay. Now, do you know if there's a tax benefit on that as well, if you have it for yourself as a self-employed person?
Great question. And again, it depends on the plan, the benefits, and who the insurance provider is. Prior to January 1st, 2019, there used to be actually a penalty if you're self-employed and you get certain plans over other plans. But President Trump has gotten rid of that as of January 1st, 2019. So you can actually get whatever plan you want, and there's no penalty tied to it.
Okay, perfect. So it really sounds like the best thing for anybody to do, because there's really so many things that can pop up, so many scenarios, so many questions. It's virtually impossible for us to point out every scenario right here on the podcast. So is there anything else that you wanted to mention as far as basis or anything that a new self-employed person, maybe they're looking to take the plunge, something they want to think about before we wrap up today's episode?
Yeah, thank you so much. And you're absolutely right. It's so individual. I just got to talk to your situation to figure it out. But when you are shopping, let's say, you're self-employed, you narrowed it down to a few options and you're looking at your options. I really encourage you to not just look at the bottom line premium amount, which is the amount coming out of your pocket every month, but there's three main things I encourage all my, clients and listeners to evaluate. One is the premium amount, how much is coming out of your pocket. Two is the deductible. How much do you have to pay out of pocket in addition to your premium before your insurance is going to give you benefits? And the last is the network. Is it an HMO network, which is very small and limited to the county that you live in? Or is it a PPO network, which is much bigger, nationwide coverage? It crosses state lines. One thing I want to point out is a plan that's costing you $300 a month with a $5,000 deductible is hugely different than a plan that is $300 a month with a zero deductible. So don't ignore that deductible. It's a huge factor in determining the quality and usage of your plan. And if it's a matter of a few bucks, let's say 20 to 50 bucks to get a lower deductible, go for the lower deductible. You're going to be happy when you actually go to use your insurance plan. You're going to be happy that it's not you paying out of pocket, it's your insurance company.
Yeah, I agree, because I know people think about that all the time. They see the monthly premium, but then they have this hefty deductible. And what they don't realize is not only are they still paying the premium, but now when they go to the doctor, they've got to meet that deductible in order for the insurance company to even come out of pocket.
Exactly. And health insurance is different, guys. You want to use your health insurance. We want you to get your annual physical if something goes wrong. We don't want you to be afraid to use your insurance. But, I found that people with high deductibles, they're like, well, I hardly use my insurance because I know that I have to pay more out of pocket.
Right.
So it's in your benefit to really choose a lower deductible when it comes to health insurance. Use the plan that you have. Don't be afraid to use it. And there are options out there that you can get a lower premium and a lower deductible. I really help kind of draw out those options for my clients too.
Perfect. So what is the listener's next step on reaching you, and what's the best way for them to get in contact with you?
Yeah, I definitely encourage anyone listening to this to reach out to me just for a conversation. If you don't even know why you're calling me, just give me a call. I think one of the surprising takeaways that I tell a lot of people, I want to tell you that, hey, you're in the best plan possible. Stay there, keep that plan, and give them that boost of confidence. So even if you're not looking for insurance, reach out to me. I can just offer you an evaluation of your current policy. I like doing that a lot, and just educating and informing. So when your situation changes for your next stage of your business, you know what to look for. You know what changes to make in your plan. So you guys can reach me I'm very active on social media. Instagram handle is Dr. Noor_health. We're currently working on a website launch, which should be ready just in a matter of days. So that's www.drnoorhealth.com. Call, text me 929-248-1621. Just reach out to me, guys. I just love educating and empowering about health insurance specifically, so you guys can make the best decisions for your small business.
Perfect. And don't forget, if you're listening to this, watching us on YouTube or Facebook, you can always leave a comment. I will make sure that Dr. Noor gets those comments. And if you, for whatever reason, just want me to connect you with her, I can do that as well. So I'm pretty simple when it comes to stuff like that, because I do appreciate the knowledge, because I know it's a very important topic. It's been a challenge of mine as being self-employed for years. So we really, 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 really appreciate it. And congratulations on being a new mom and going through all this stuff during the pandemic. It's crazy. But when this episode actually drops, we're just about wrapping up 2020. So that's I know a lot of people are ready. So, but it's always a blessing. So, and I appreciate you being a part of it.
Thank you so much, Shondine. I had so much fun. I hope your listeners got some value out of what I had to say. I'm very open. I love communicating, love educating. You guys feel free to reach out to me anytime. Thank you so much, Shondine.
All right. Thank you so much. Don't forget to like, subscribe, and share. Don't forget to hit that subscribe button on YouTube, Facebook, all of the podcast servers that you're listening to this on, because we don't want you to miss quality information just like this. Until next time.
You've been listening to Certifiably Unemployable. Ready to fire the boss yet? You're on your way. Sean has been self-employed for over 20 years. So if that's something that you want to do, something you've been dreaming about for years, Sean has all the knowledge, good, bad, and indifferent. We hope you've gotten some useful and practical information from this show. And we'll be back soon. But in the meantime, hook up with us on Facebook and Instagram at Certifiably Unemployable. Find us on YouTube and at www.certifiablyunemployable.com. Till next time, this is Certifiably Unemployable, signing off.